Thank you so much for joining us to celebrate the second anniversary of the Affordable Care Act. I'm so pleased to be here this morning at GBS Group with CEO Maria Antonieta Diaz and her employee Loredana Ramirez. They will both speak about what the Affordable Care Act has meant to their business and their employees. Thank you both so much for being willing to share your personal stories and the positive impact that the new healthcare reform law has had on your workplace and on your families. It was just 2 years ago that President Obama signed the Affordable Care Act into law. This game-changing law marks a historic shift in our country. The landmark healthcare reform law provides health insurance to 31 million more Americans and lowers healthcare costs while at the same time creating jobs, strengthening the middle class, and reducing the deficit. Already, American families and small businesses are asserting more control over their healthcare by reducing costs, increasing choice, and instituting common sense rules. At long last, healthcare in this country can be considered a right for all Americans and not just be a privilege for those who can afford it. It has already saved Florida seniors more than $141 million in prescription drug costs. Nationwide, 2.5 million young adults can now remain on their parents' insurance until they're 26 years old. The Affordable Care Act also provides important preventative services, turning our healthcare system from a sick care system into a wellness and prevention system by making sure that services like birth control, mammograms, and colonoscopies are free of copays and deductibles. It boldly outlaws, and that's important for 3 women like us, but it boldly outlaws egregious insurance company practices like gender rating, charging women more for health insurance simply for being a woman. It also puts a stop to insurance companies denying coverage based on pre-existing medical conditions. And for me, as a breast cancer survivor, that's personally very important, but important to the 129 million Americans that live in this country with a pre-existing condition. The Affordable Care Act is also closing the Medicare prescription drug donut hole, that coverage gap in prescription drugs, and making sure that we protect the doctor-patient relationship and bring down the deficit as well. In just its first 2 years, this legislation has already helped millions of Floridians live healthier lives, and now it is on the right path to fixing our nation's broken health insurance system. And we have so much to look forward to in the next few years as the law is fully implemented by 2014. Soon, insurers won't be able to discriminate against any of the 129 million Americans who live in this country with pre-existing conditions. And there will be state-based competitive marketplaces where millions of Americans without access to job-based health coverage will have access to affordable, quality coverage. And for those who own small businesses like Maria, the new healthcare law is already making a difference in the bottom line. For too long, small business owners have struggled to keep up with ever-rising costs of health insurance for their employees. And I can tell you, I get stopped so often by small business owners when I'm home in the district in South Florida who tell me how tough it is when every year they have, at a minimum of an 18% increase in their premiums, how often employers like Maria have to change policies, change plans, change companies, start over again. Maria actually wasn't even able to provide insurance to her employees until now, and we'll talk about that in a moment. But it is really frustratingly difficult when every single year, because of the increase in costs, employers have to drop coverage of one company, start over with another one. Employees have to go to new doctors, start over again, and having an established relationship with your physician and a relationship that is built on trust really is important, especially when you get faced with an unexpected healthcare challenge. So the Affordable Care Act now makes it easier for businesses to find better coverage options, and it builds on our employer-based insurance market that's already in place. It gives the consumer and business owners more control while also making healthcare coverage more affordable. Small businesses, as I said, have historically paid 18% more for health coverage than larger employers. Right now, a tax credit is available to businesses with 25 or fewer full-time employees, businesses just like GBS Group here today. And starting in 2014, small business owners will get more relief with the tax credits increasing to 50%, and affordable insurance choices in the new affordable insurance exchanges in every single state. Small business owners will be able to offer their employees a range of plans from different insurers, just like big employers do, while still receiving a single bill and writing a single check. And because small business owners will be joining a much bigger risk pool, a lot more people that are going to be in the same pool, bringing down those costs, they're no longer going to be vulnerable to sharp swings in prices and in their rates based on the health of just a few employees. That's because the law prohibits insurance companies from setting premiums based on the health of an employer's employees. In short, the new healthcare law makes improvements to the health insurance system that we already have and gives states the flexibility to implement the new law in the way that makes sense for their own insurance markets. And the new law does not add a dime to the deficit. According to the Independent Congressional Budget Office, the new law is completely paid for through a wide range of cost-saving reforms, from cracking down on healthcare fraud, which we know, unfortunately, in South Florida, we are a haven for Medicare and Medicaid fraud, but the Affordable Care Act has cracked down on healthcare fraud and made sure that the government has been repaid hundreds of millions of dollars. It also makes sure that we can get people to hospitals and doctors and reestablish the doctor-patient relationship. Now, as the fight to repeal the healthcare law continues, we can't allow Republicans and insurance company bureaucrats to take us backward to a time when only those who could afford it could get the health care they need. Today marks the opening of the oral arguments at the Supreme Court to repeal these monumental reforms. We must stand together to support the Affordable Care Act and let others know how much it's already helping people right here in South Florida, which is why I'm standing here today with Maria Antonietta Diaz and with Loredana Ramirez. Maria, if you could take a moment to tell us what the Affordable Care Act has meant for your business and your employees.
First, I want to, it is a great honor to have Congresswoman Debbie Wasserman Schultz come on today here in our office. And thank you for this great opportunity to share our experience as a small business owners. We have been in business for 12 years and recently have been able to add health insurance benefits to enhance our employees' compensation package. 4 years ago, we tried to implement health insurance benefits in our company. However, it was too expensive for us and also for our employees. 2 years ago, thank you to the Healthcare Act and the credit offered to a small business, we will finally give the benefit to our employees. This has allowed us to be able to better meet our employees' health care needs. And also, it's a great tool to attract new employees. And for us, it's very important to give to our employees and their families the opportunity to have health care. And thank you so much for this opportunity.
Absolutely, absolutely. And now I want to ask Loredana Ramirez to talk about what it's meant for her employer to now be able to offer her an insurance plan. Loredana?
Okay, my name is Loredana Ramirez. I'm so glad to have this opportunity to tell you my story. I feel so proud and so grateful because of Maria Antonietta Diaz. Well, it started like since 2005. I don't have an insurance, no credit cards. I lost my mom since I was 21. I have to take care of my sister. I feel insecure, didn't have any backup, no one to go in and ask for help. It's pretty scary. I used to tell my sister that she has to be careful every time she goes out because you never want to like have anything to happen to her or to me. When you get a flu, pretty much you have to self-medicate yourself because going to the doctor, even to the family doctor, it's pretty expensive. If you want to get antibiotics, expensive too. I do believe that security in a human being is a very important in our day-to-day. I'm sorry. Okay, now, now I'm so glad that every year I have the opportunity to go to and take my Wellness Woman exam annually. I'm not self-medicated anymore. I go to the doctor, they tell me what I have. And, well, it's great just to have, and to feel that you are under someone's wing and they taking care of you.
Yeah, that's great.
Thank you.
Thank you very much. We'd be glad to take any questions. Thank you so much.
So the Supreme Court is today talking about this CARE Act
Right.
and everything. How did that affect you, your thoughts? What do you think should go forward?
Well, Republicans have been leading the charge since we were debating this legislation in Congress to repeal it once it passed and completely take us back to the days when insurance companies controlled our decision making, controlled what kind of health care we could get, and prevented small businesses like GBS from being able to offer insurance to their employees. I mean, it would simply be unaffordable, as Maria told you, to provide insurance to the 21 employees that work here without the Affordable Care Act. And now, I mean, Laura Donna was not able to go get well woman visits. That was hard for me too.
Thank you.
No problem. Well woman visits before she had insurance, and now that she has it, I mean, I can tell you as a breast cancer survivor, those well woman visits give you an opportunity to get a clinical breast exam. And as you get older, as you approach 40 and past 40, you want to make sure that you can get those annual visits taken care of every year, because you just never know. I was 41 years old when I was diagnosed with breast cancer. I found the lump myself, but it was after a clean mammogram. And so making sure young women can get breast cancer, and there can be problems that crop up unexpectedly. Young people think they're invincible. Being able to stay on their parents' insurance until they're 26 years old, when God forbid, something happens. In Laura Donna's case, her sister, if she had gotten sick, she had to caution her every single time she went out, because it was a problem if she got sick or injured, because it would have potentially medically bankrupted her family. I mean, I would imagine that without insurance, if something serious happened, God forbid, that there was no safety net for her family without insurance. Now with the Affordable Care Act there is. And the Supreme Court will hear oral arguments today on whether or not the insurance mandate portion of the law is constitutional. We believe strongly that it is constitutional. It's been ruled by many federal courts, lower courts already, that it is. Congress can regulate commerce, but at the end of the day, we need to make sure that we give every American the peace of mind that they need, that they do not have to worry about where they're going to get their access to basic health care. That should be a right in this country, not a privilege that is only reserved for people who can afford it. And for employers like Maria, who really want to be able to provide that safety net for their employees, who want to make sure that their employees don't have to not show up for work because they're sick. If she keeps her employees healthier, they are going to be able to be more productive. And at the end of the day, it's going to actually cost less in terms of making sure that her employees are able to be here every day doing their job and not out on sick leave that they can't go get taken care of.
So this bill is really important for small businesses, and I mean everybody across America, but small businesses will.
It is. It's important for the 31 million Americans that will get insurance that